Hello, everybody. Good night. So, welcome to our Facebook Live. This is Thursday again. It's February 11, and we're going to have our Facebook Live at 7 p.m. tonight. So, we have prepared questions for you on nursing, prioritization, and delegation. So, before anything else, my name is Mr. Alan Matus, and I am a nurse educator. I have been teaching students NCLEX for almost 25 years. I am also a nursing faculty at this time. I'm helping students pass their nursing program. And also, I'm the owner or the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. And also, I'm the author of a book that I published in Amazon. And this is the simple, fast, and easy NCLEX review. And you can find that in Amazon, everyone. And it's also available in the Philippines. So you just email Matus Nursing Review Academy at gmail.com for inquiries, and we will respond to you because we have black and white copies in the Philippines as well. Okay, so that's my book. So if anyone in the group likes my book, can you please give a shout out? Okay, thank you guys. All right, so let's welcome some people tonight, and let's see who just came in. So we have Amber Liu just came in, Jude, Kaylis Johnson, also Misumi, Makon Boncolmo. Okay, we have also Olayinka Migbeke. I think she's our student in the online academy. Also Sale Aquino, who's my student, of course. Also, we have Ija Kano. Lisa Maria is watching us tonight. Okay, is watching with us tonight. And then Menchi, hi Menchi, how are you? From Singapore. We have Oji Chukwo Kiyonse. And then thank you very much for your comments, everyone, about the workbook in the comment section. So I think I have Itohan say something. She said, my friend used the workbook and passed. I'm looking forward to mine soon. So thank you very much for that. All right. So I think the workbook is one of our success stories. You know, a lot of students really like the workbook, everyone. Okay, before anything else, I would like to greet everybody a happy Valentine's Day. Okay, happy Valentine's Day, everyone. I hope that you are spending your weekend happily with your significant others. It's Valentine's Day. You know, the days are passing so fast, and we are in 2021, and now it's February, and then after that it's going to be March, April, May. So before you know it, the year is over. Okay, all right. So another one. So happy Valentine's, everybody. Okay, and thank you for those people who has greeted me also in the comment section. Now also, we have an announcement, Valentine's Day and also President's Day. So we have an upcoming sale that's going to be Super President's Day sale from February 14 to 17, 2021. Unfortunately, it's only 4 days. So the sale is only until February 17. So we have 50% off for our self-study programs. So instead of $4.99, it's only $2.49. We also have 30% off for our NCLEX Success Workbook. So normally it's $94. Now it's only $66, guys. So that's a very good deal. Okay. Then you also have 30% off for the 12-week Fast Track Live NCLEX Review webinar. So we have a class that we do every Tuesday right now. So if you want to join that class, feel free also. We have discounts for that. So check our website at Matus Nursing Review Academy.com or matusnursingreview.com for this limited time offer, everybody. Okay. And also we have some greetings in the comment section. Thank you very much. All right, so if you're ordering from Saudi Arabia, my book, I'm not really very sure how you can order that. Maybe also in the website, Amazon, I guess, you know, they will deliver. The only problem is that it's going to be a little bit more expensive, I guess, because of the shipping. Also, another in our agenda also for tonight will be the our testimonials. Okay, so we have our testimonials from students in the online academy at this time. Okay, so these are my students who are enrolled in the program. So some of you may recognize your names there. So, or not your name, but your testimonial, everyone. So we have the first one. She said, I got this yesterday. I am really learning and enjoying the lectures and questions. I will watch again and redo the test once more. Thank you so much, sir. Okay. We have another one from Anna. So she said, yes, I learned so much here, very well presented, that it helped me remember more than any other material I've used before. Thank you, Sir Alan. And then lastly, for fluids and electrolytes, we have this comment 3 months ago. I want to thank you, Mr. Allen, for your lectures are above beyond the best review from all the reviews I've been taking for the past. I wish I knew your review program since day one. I feel so much positive learning. I will recommend your NCLEX review. 100% the best lecture in the universe so far. I'm learning much from you. So thank you very much for that. Okay. All right. So we also have a shout out. Okay, let me see. Okay, so that's it. And then, of course, for tonight, whoever is joining for tonight, guys, you will be entered into a raffle again. And maybe you will win, the free 90-day online access NCLEX review. So that will be for 3 months. And we do that immediately after the event or the show tonight. So keep posted so that you can see if your names are the winners, or your name is the winner rather. Okay. And also, before anything else again, if you could kindly, only if you can share this with your friends or your timeline so that your friends will also benefit. Okay. And then also, if you're watching this in YouTube, can you please click like and subscribe? Okay, so that you will get updated with our latest videos also. Okay, and all the questions that I have here in the Facebook Live, I think we have lots of questions already since the beginning. This is our session 45 now. All the questions that we had here in the Facebook Live will be published in my next book. So all the questions will now be in print formats with rationals and answer keys. So if you have no time to watch the Facebook Live sessions that we had before, or the videos, you can just grab the book and read that as well. Okay, so that's going to be coming up in the next, let's say, weeks or months maybe. Let's try to find out, guys. Okay. All right. So are you ready for our first question for tonight, everyone? Okay. So we had Rowena, Mia, Tandok, Menriza, Janet Hernandez, Princess Corpus, Serena Go, Mulu Hadera. So we have a lot of people tonight joining us. Okay, so are you ready for the first question for tonight, everyone? We have your prioritization question as usual, because prioritization is part of your NCLEX. We have the NCLEX Next Gen. Have you heard about that? The new format of NCLEX coming in 2023. So you will have new types of question formats for the NCLEX. That will be 2023 for both NCLEX-PN and NCLEX-RN. Okay, and the reason for the next gen question from the NCSBN is because we really want to measure as much as possible the clinical judgment abilities of our nursing examinees. Okay, so let's have our first question, everybody, for tonight. Okay, so I will read the question, everyone. Okay. So the nurse receives the following clients after a change of shift report. Which client requires immediate attention during walking rounds? A, the 38-year-old client with NGT attached to low suction who complains of nausea and abdominal distension. B, the 56-year-old client who was recently admitted for left lower abdominal pain due to acute diverticulitis. C, the 43-year-old client who requires analgesics before a wound debridement procedure. Or D, the 27-year-old client who has a respiratory rate of 12 breaths per minute after administration of morphine sulfate. So which patient or client requires immediate attention? Okay, again, the nurse receives the following clients after a change of shift report. Which client requires immediate attention during walking rounds? A. The 38-year-old client with NGT attached to low suction who complains of nausea and abdominal distension. B. The 56-year-old client who was recently admitted for left lower abdominal pain due to acute diverticulitis. C. The 43-year-old client who requires analgesics before a wound debridement procedure. Or D. The 27-year-old client who has a respiratory rate of 12 breaths per minute after administration of morphine sulfate. Okay, so what will be the answer, everyone? Okay, please use the process of elimination in answering this question, everyone. Make sure that you just don't jump into the options. You have to make sure that you're looking at each option properly. Okay, so check the items one by one. Which patient is the most unstable and needs immediate attention? Okay, so which patient will that be? Be very careful. Okay, be very careful, everybody, of your answer. What is the answer, everyone? Okay, A, B, C, or D? Okay, we need to know the answer for these questions. Is it A, B, C, or D, everyone? Okay, what will be the answer, do you think? Okay, so are you ready for your answers, everybody? I'll give you time to change your answer a little bit if you want. Okay? Okay, so let's see. What's the answer to this question? Okay. All right. So we have different answers from you guys. We have some people answering letter A. So we have some people answering letter D. The answer for this question, everyone, is going to be letter A. Now, why is letter A the answer, everyone? Okay. I think some of you answered letter D because the respiratory rate is 12 breaths per minute after giving morphine sulfate. The question that we have for letter D is, what is the respiratory rate that we need to report, okay, when a client is having opioid toxicity? Because I think we have different sources. For some of their sources, the morphine sulfate should be at least below 12. Less than 12 is the one that you have to report. So 12 is still acceptable for a patient with receiving morphine sulfate. That's why the answer is going to be letter A, because for letter A, that is a patient having suction, NGT suctioning, and then complaining of nausea and abdominal distension means that there is an obstruction in the system. So obstruction in the system that causes the patient to have nausea and abdominal distension, and that is uncomfortable. And at the same time, we need to address that immediately. What's causing the nausea and abdominal distension? So your letter B is not the answer, because even though it says recently admitted, so you will be like, oh, that is an unstable patient because recently admitted. Yeah, that's correct. However, you have to look at left lower abdominal pain. That is a characteristic symptom of acute diverticulitis. Am I right? Acute diverticulitis. Now, letter C, analgesics before a wound debridement. That is also important. However, it's not the first one that we have to address. Letter D, respiratory rate of 12 is still acceptable. Okay, because less than 12 is the one that we need to report, because it means that we have opioid or narcotic overdose. And can someone tell me in the comment section, what's the antidote for your opioid overdose? What's the antidote, everyone? Okay, so the antidote is naloxone or Narcan. And I do have a question though. Aside from Narcan or naloxone, you know, the generic name, Can you give me other examples of antidotes for opioids? Okay. Now, letter B is not the answer because that's a classic symptom of acute diverticulitis. Unless you have board-like abdomen, tender, fever, for example, that could be a sign of peritonitis. All right. So you have naloxone, yes, but we have other opioid antagonists. We have your nalorphine, nalin, levalorphan for infants. Okay, so remember that, everyone. Okay, so the answer to this question is going to be letter A, everyone. So you can see that B and C are unstable patients maybe, or let's say they need attention, but letter A needs attention immediately because that's an obstruction in the nasogastric tube and we need to address that, okay? Especially that nausea, abdominal distension could be very painful as well, okay? All right, so that's the answer, everyone. Letter A, everybody. So be careful with your values, okay? Your respiratory rate for morphine sulfate administration. Okay, so let's go to the next question, everyone. So we have number 2. Okay, another prioritization question, everyone. Okay, so the question is, the nurse cares for several clients in the postpartum unit. Which client requires immediate attention? Which client requires immediate attention? So this is maternity nursing, everybody. A, the client who reports painful cracked nipples after several breastfeeding sessions. B, the client was profuse sweating and a temperature of 99 degrees Fahrenheit an hour after delivery. C, the client who is 2 hours post-delivery with a fundus deviated from the midline. Or D, the client was red and fleshy smelling vaginal discharges 2 days after delivery. Okay, so let's read again. The nurse cares for several clients in the postpartum unit. Which client requires immediate attention? A, the client who reports painful cracked nipples after several breastfeeding sessions. B, the client who has profuse sweating and a temperature of 99 degrees Fahrenheit an hour after delivery. C, the client who is 2 hours post-delivery with a fundus deviated from the midline. Or D, the client who has red and fleshy smelling vaginal discharges 2 days after delivery. So what do you think is the answer, everyone? Which one here requires, or which client requires immediate attention? Okay, all right, so we would like also to welcome some new people for tonight that just who just came into our Facebook Live. So we have okay, so let's see who also came in tonight. Let's give them a shout out. Okay, so we have Ange Marie Louise. We have Alfred Tablada. Okay, also came in tonight. Okay, we also have Isha Kanu, Nel Roma also, Rajmi Shrestha, and Lisa Logisti. So what's your answer, guys? Is it A, B, C, or D? So which one here requires immediate attention? So you have to remember that you have to go back again. What are the normal findings after delivery? And which one is considered to be abnormal and poses a danger? And I do discuss this in the academy as well. So you really need to know what are some of the important priorities, after delivery. So which ones are abnormal or normal? So we have Avarkama Aurora. Thank you for coming in tonight. Okay, so I'll give you the answer in a moment, guys. Okay, all right. So just kind of like when I share this, Kadiatu said, I love your book. It is powerful. Thank you very much for that. Okay, so let's see the answer for tonight. Can you give your rationale, everyone, why you chose letter A? Why is it letter B, letter C, or letter D? Okay, so the answer is going to be, all right, so the answer to this question, we have different answers in the chat box. The answer to this question, everyone, is a very important concept, in maternity nursing, especially after delivery. I always discuss this in the academy. I really emphasize this to students, especially the assessment finding, especially that what can happen to the mother if you see this. So the answer here is going to be, okay. All right, so the answer is going to be letter, okay, it's going to be letter C. Okay, letter C. So the answer is letter C in this question because number one concept you have to remember is this: when the fundus is deviated from the midline, especially to the right, it means that the bladder is distended. And if the bladder is distended after delivery, that will inhibit the ability of the uterus to contract. And if the uterus is unable to contract, that can lead to hemorrhage or vaginal bleeding, severe vaginal bleeding, or hemorrhage or severe uterine bleeding, rather. Okay? So bleeding will happen. So that's the reason why you need to address first your patient or client who has a fundus deviated from the midline, because that is a sign of a distended bladder. And thank you very much, Alfred. You got the correct reason why letter C is the answer. So the question is that the priority? Yes, because after delivery, we all know how important it is to have a contracted uterus to prevent hemorrhage. Is that clear? The uterus must be monitored for contraction. Okay, now why is letter A not the answer? Painful cracked nipples, that's a priority. Also, why? Because that can lead to mastitis. But is it the number one? No. So C comes first before letter A. Now letter B, profuse sweating or diaphoresis and temperature of 99 degrees. Always remember that sweating or profuse sweating could be an expected experience after labor and delivery. Okay? After delivery. So sweating is okay because the mother has to lose all the fluids that she accumulated during pregnancy. And then the temperature is 99 degrees, meaning that there is no infection going on. However, if the mother has sweating, diaphoresis with increased body temperature, that could be a sign of maternal sepsis. So that's why letter B is not the answer, because there's nothing alarming. You have to look at the combination of symptoms, sweating and temperature. Okay? There might be something going on wrong later on, but we don't know. But for now, it's not really very clear. That's a normal finding, your letter B. Now, your letter D is not the answer because your letter D is your lochia rubra. You know, and you all know that lochia rubra is your dark red vaginal bleeding, your lochia, in the first 1 to 3 days or 4 days after delivery. So this mother is just 2 days after delivery and fleshy smelling, and that's the smell of your lochia. You know, it's like a heavy menstrual flow. So that's why letter D is expected. That is okay. Letter B is okay. So letter C is the priority because you don't want the mother to bleed. You want to make sure that you massage the uterus, okay, assist the mother to the bathroom to void, and then massage again the uterus, everyone. So massage, void, massage, okay? Making sure that the uterus is contracted. So I hope everybody learned from that explanation, guys, okay? All right. So that's all about your question number 2. I think that was challenging for some people, okay? Don't forget that the concept of the fundus deviated from the midline is always in the NCLEX. All right, so let's go to number 3, guys. All right, so number 3 is going to be about dumping syndrome. Okay, are you ready about this question in the NCLEX, everyone? So the nurse is giving this charge teaching to a client who underwent Billroth 2 or gastrojejunostomy. Which instructions are appropriate to prevent the occurrence of dumping syndrome? Select all that apply. A. Lie down after meals. B. Encourage intake of chicken, fish, and eggs. C. Drink more fluids during meals. D. Eat small meals throughout the day. E. Add table sugar in beverages. And F. Eat slowly and chew the food well. Okay, so you have your select all that apply. And dumping syndrome is a favorite in the NCLEX if you don't know that, everyone. Okay? And also, can you please indicate in the comment section from which country are you coming from, everyone, or from which state in the United States? Okay? Can you please indicate that? I would like to find out where my students are coming from. Okay. All right. Okay. So let's continue. Again, the nurse is giving discharge teaching to a client who underwent bilirubin or gastrojejunostomy. Which instructions are appropriate to prevent the occurrence of dumping syndrome? Select all that apply. A. Lie down after meals. B. Encourage the intake of chicken, fish, and eggs. C. Drink more fluids during meals. D. Eat small meals throughout the day. E. Add table sugar in beverages. Or F. Eat slowly and chew the food well. Okay. So you have to go back to the pathophysiology of dumping syndrome. What happens in dumping syndrome, everyone? And just to give you an idea, when you say Billroth-2 or gastrojejunostomy, it means that we are removing part of the stomach and then we are removing the duodenum because the patient has duodenal ulcer. And then we anastomose part of the stomach to the jejunum, and that's why you call it gastrojejunostomy. So we are removing part of the stomach and the small intestine, which is your duodenum. So Billroth-2 means your patient doesn't have or does not have your duodenum anymore. Okay? All right. So let's see the answer to this question, everyone. All right. So let's see. Okay. So Itohan. Okay. So let's proceed. The answer is going to be, I'm giving more time for other people because I think they are still deciding what will be included in this select all that apply. And dumping syndrome is a favorite in the NCLEX, so you really need to know what are the general nursing interventions to prevent the occurrence of dumping syndrome. Okay, so the answer to this question, everybody, will be, let's see, are you ready for the answer, guys? This is the answer, everyone. So that would be A, B, D, and F. A, B, D, and F. Okay, let's review dumping syndrome a little bit, everyone. So dumping syndrome is a syndrome that happens because the patient underwent gastrectomy or removal part of the stomach or the colon, for example, the small intestine rather. So with the removal of the small intestine, your duodenum or part of the stomach, it causes food to rapidly enter the small intestine, causing fluid shifting and signs and symptoms of shock. So your patient is going to have dizziness, patient may have sweating, sometimes explosive diarrhea, sometimes immediately after eating. Okay, dizziness, sweating, tachycardia, hypotension because of the fluid shifting, and the rapid entrance of food into the small intestine. So in short, the small intestine gets overwhelmed. Now, the goal to prevent dumping syndrome is to slow down the entrance of food into the small intestine and also to teach patients to avoid foods that are hypertonic in nature. And foods that are hypertonic are high in carbohydrates. So we have to avoid carbohydrates if you want to prevent dumping syndrome. Okay? So you lie down after meals, encourage intake of chicken, fish, and eggs because the diet for dumping syndrome could be high protein, okay? High protein, low carbohydrate diet, okay? And then also, letter D is correct because you have to eat small meals only. Avoid 3 large meals. Rather, it should be 5 to 6 meals throughout the day. Letter F is correct. You have to eat slowly and chew the food well. Okay. Now, your letter C is not the answer because you have to avoid fluids during meals because that causes rapid entrance of food into the small intestine. Avoid table sugar, okay, because that's your carbohydrate. The diet should be low in carbohydrate, everyone, okay? All right, so that's it. We have some students who really gave us very good rationale there. Lie down, no fluid with food, high protein, and no carb. That's correct, Misumi. So just be aware of your intervention for for dumping syndrome. The question that I have is, in dumping syndrome, the diet is high in protein, okay, low in carbs, but the question is it high or low fats? Okay, that's the question, because we have different materials saying low fat or high fat. We will answer that later. So the most important thing, it has to be low carbohydrate diet for dumping syndrome, everyone. Okay, so Itohan said protein is good for dumping syndrome. That's correct, and that's why letter B is correct. Encourage intake of chicken, fish, and then also your eggs, everyone. Okay, so I'll stop there with dumping syndrome, everyone. That's the most important. Okay, and remember also that some patients with dumping syndrome, I think the complication also could be hypoglycemia, I guess, like low blood sugar, because they suddenly release insulin. That could be a complication, I guess, but that's going to be another story. Okay, everyone, so we are done with that. Are you ready for our last question for tonight? So this will be the delegation question, everybody. Okay, so we have a lot of students here. Okay, so hello, sir. I passed NCLEX. I saw some of your SATA in NCLEX. Thank you for this thirst review. Oh, thank you very much, Destiny. Destiny, if you have time, can you please make a Facebook recommendation so others can read that as well? Thank you very much, Destiny, and congratulations for passing your NCLEX. Okay, so the next question that we have is going to be delegation. So this delegation question is, let's read the question. The registered nurse is teamed with several unlicensed assistive personnel, or UAPs, and a licensed practical nurse, or LPN, in the medical surgical unit. Which of the following tasks can be delegated to the LPN? Select all that apply. Okay. A. Perform perineal and oral care. B. And also we have Bindo Jose also passed the NCLEX. Congratulations also, Bindo. Hopefully that our session was able to help you as well. Okay. B. Have a client sign a biopsy consent form. C. Give morphine sulfate IV every hour. D. Inject COVID-19 vaccines. E. Administer 100% oxygen via the non-rebreather mask. Or F. Assess the skin around the stoma during colostomy care. Okay, next. So the registered nurse is teamed with several unlicensed assistive personnel, or UAPs, and a licensed practical nurse, okay, in the medical surgical unit. Which of the following tasks can be delegated to the LPN? A. Perform perineal and oral care. B. Have a client sign a biopsy consent form. C. Give morphine sulfate IV every hour. D. Inject COVID-19 vaccines. E. Administer 100% oxygen by a non-rebreather mask. And F. Assess the skin around the stoma during colostomy care. So always remember that RNs do not delegate planning, evaluation, teaching, and assessment. Remember that. RNs do not delegate planning, assessment, teaching, and evaluation. So you have to go line by line here and ask yourself, is this within the scope of practice of the LPN? Okay? Is this within the scope of practice of the LPN? So you have to, word for word or line by line, is A included? Is B included in the practice of the LPN? Is C included in the practice? D, use your true or false. I'm giving you enough time, everyone, to really think hard. Don't be lazy thinkers. Think very hard. Some answers are incorrect in the comment section. So I'm giving you time, okay? I'm gonna give you a clue. There's more than 2 answers in this question. There's more than 2 answers. There is more than 2 answers, guys. More than 2 answers. Okay, you have to ask yourself, can she do A? Can she do B? Can she do C, D, E, and F? Okay? There's more than 2 answers. Okay, So the answer to the question, everyone, I have given you enough time, and I think most of you are like, what could be the answer here? Okay, so practice, 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 practice. Okay, so the answer to the question is going to be interesting. Okay, so let's have the answer, everyone. I think a lot of you were struggling a little bit, but then just really practice. Now, you know what? This question is really a very good question, and I hope that you will learn something out of this question for tonight. Okay, I told you RNs do not delegate evaluation, do not delegate planning, do not delegate uh, assessment, and teaching also. So what do RNs do? RNs do coordination, they do collaboration, they do management of care, teaching, assessment, evaluation, okay? And planning, developing the care plan, anything that is complex. So the answer to this question, everyone, is going to be it's going to be letter A, B, no, it's going to be letter D, E, and F. So congratulations, Ursula, you got the right answer. That would be your D, E, and F. Very good. Now, is injecting COVID-19 vaccine within the scope of practice of the LPN? Of course. Flu immunizations, injections, that's within the scope of practice of the LPN. Injections, right? Letter E, administer 100% oxygen. Of course, yes, that's oxygen administration. Letter F, assess the skin around the stoma. Yes, when LPNs change the colostomy bag of your patients or provides colostomy care, part of the responsibility is to do assessment, right? Assessment of the skin around the stoma. So let's try to clarify this, everyone. Okay, now letter F is included in the practice of the LPN because what did we say in this Facebook Live many times already? LPNs can assess as long as it is a focused or specific assessment. When it comes to comprehensive or first-time assessment or initial assessment or admission assessment, that would be for the RN. Like teaching, like assessing the colostomy stoma, you know, or the skin or the stoma immediately after surgery, that would be the RN. Okay, but during colostomy care, regular colostomy care, then the LPNs can do assessment. They can assess bowel sounds, they can assess the skin around the stoma, they can auscultate the heart rate also, or count the heart rate. And what the LPN has to do is to report to the RN the findings, and the RN is the one who will interpret and analyze and find out what's really going on. So analyze the assessment findings. Okay, so F is included, okay, because that is a specific assessment. It's not a comprehensive assessment, it's not an initial admission assessment. So that's why F is included. Now F can also be changed into, like, let's say, assess or check. You can also check the skin around the stoma. That's also okay, you know, or because assessment means checking also. So that would be correct. Okay, so your letter A is not included because your perineal and oral care is for the UAP, okay, or CNA. Your letter B, have the client sign a biopsy consent form. Who should make the patient sign a biopsy consent form? Who should do that, everyone? Who should do that? Is it the RN? Is it the LPN, the UAP, or the physician who will perform it? Who will get the consent? Okay, so the question is, who will get the consent? Should it be the RN? Okay, remember, if that is a biopsy, okay, that's a procedure. There are risks in biopsy. I would rather prefer it has to be the physician who should explain and get the consent. Am I right? Because explaining the risks and benefits of the procedure for any surgical procedure, it has to be the physician. Okay. So letter C, giving morphine sulfate IV, intravenous, that's not LPN. LPN only gives oral, IM medications, okay, or subcutaneous, but not your IV. So be very careful when you read the option, guys. Read word for word, okay, and ask yourself, is this within the scope of practice of the LPN generally? Okay, all right. So the nurse is only a witness for the signing of the consent. You know, witness means that it's really the patient who signed the consent. Okay, and that it was explained. But any misunderstanding about the procedure, it has to be referred to the physician or to the surgeon. Okay. Okay, guys, I hope that you learned something tonight. Okay, so we only had a few questions, but then I hope that you were learning a little bit and apply these concepts to other questions also when you're taking your NCLEX. And congratulations to those who passed the NCLEX, and hopefully that this program was able to help you guys. And always remember, think positive. So if you want something to remind you every day that your dreams are possible and you can reach them, so you can be part of the Matus tribe. We have this Think Positive sweatshirt, so you can get them from our merchandise store. So just visit matusnursingreviewacademy.com, everyone. Okay. All right. And for last week, our winner was JD Matthew last week. So immediately after this session, guys, I want you to keep posted, because we will post the winner for tonight's raffle every one. Okay. So JD Matthew, I think JD is already enrolled, but can you please congratulate JD Matthew? Okay. So Menchi said that, thank you, sir. Need to study more to retain what you have taught in the academy. I've been away for a few months, but I'm back and I'm happy. So you call that determination. Okay. So we have another shout out. Well explained. Thank you. Okay. All right. So thank you very much, everyone, for being here again tonight. And I will see you again next Thursday. So again, happy Valentines, everybody. And don't forget, we have a sale going on from February 14 to 17. Thank you very much, everyone, and have a good night.